today we're going to look at anemia, we're going to look at hypertension, also called high blood pressure, and dental caries, which is just another word for dental decay. So we're going to start here with anemia. Now, it's automatic that when you say anemia, people think, oh, a lack of iron or a deficiency of iron in the diet. But I just want to remind you, on our home economics course, we have mentioned 3 types of anemia so far. Now, the most common type of anemia is called iron deficiency anemia. And obviously, we're saying that if there's too little iron in the diet, and we covered that in the minerals chapter. Then we have a second type of anemia, and it's called macrocytic anemia. And macrocytic anemia is due to a lack of 2 different B vitamins. So we can get macrocytic anemia if we are lacking in pyridoxine, which is vitamin B6, and we can also get macrocytic anemia if we're lacking vitamin B9, folate/folic acid. And then our third type of anemia is called pernicious anemia. And pernicious anemia we looked at when we were talking about vitamin B12 cobalamin. So as an honours student, if you read the word anemia, in fact, one year on a short question, there was a little box and students were asked anemia causes, symptoms and ways of or treatment. So causes, symptoms and treatment. And you'll always know, excuse me, the students at the top end of the scale where they will say, what kind of anemia are they talking about? And I would say, be specific and go with maybe the most popular type, which would be iron deficiency anemia. But that's when you know that students have really grasped what you're trying to say to them in terms of the level of detail required on a top paper or a H1 home economics paper is quite high, very high. So there are 3 types of anemia. Now, the symptoms of anemia are quite similar. So we'll just mention some of them. But as you can see, the symptoms might be similar, but the cause is quite different. So we note that a person might feel dizziness or they might feel faint. That is because, remember, we have a conjugated protein called hemoglobin. Heme part happens to be the iron part, globin is the protein. And we said in our minerals chapter that hemoglobin, this conjugated protein, has a very special ability, and that is its ability to pick up oxygen when there is, the diffusion of gases in the cells or alveoli in our lungs. So hemoglobin picks up oxygen, forms oxyhemoglobin. And remember, we said the oxyhemoglobin goes around the body, handing over the oxygen to the various cells and tissues in the body, and then comes back to the lungs again, diffusion of gases, and picks up more oxygen, etc. So if there's a lack of oxygen, particularly to the head, this will lead to the dizziness or faint. Also, a lack of oxygen can lead to fatigue or this tiredness. So fatigue or tiredness. Then you have an inability to exercise normally. So shortness of breath, for example, we could write here. And then in terms of a person's pallor or colour, so pale skin. and forget that old wives' tale or whatever you want to refer to it as, where people go to a mirror. I'm not going to frighten anyone. Go to the mirror and they pull down just underneath their eye, and if it's not bright red, oh, I'm anemic. The only way that you know if you're anemic is a blood test, no other way. So they're the symptoms of anemia. Now, another one we did mention was, remember, glossitis. And glossitis is where the tongue can be very red, very sore. It looks quite ulcerated, and that's often a symptom of anemia. We mentioned as well things like, the hair being brittle, skin not being in very good condition, nails as well not being of very good condition either, because if there's a lack of oxygen into the body or into the blood, well, then the body has to prioritize where that oxygen is going, and so on. Right, so just to go back here, anemia is a condition. It could be due to a lack of iron in the blood, or I want you to write down here a low level of vitamin B9, a low level of vitamin B6 pyridoxine, or a low level of B12. In fact, I would put here to, at the bottom, revise vitamin B6, vitamin B9, vitamin B12 and iron. Remember, they all work together collectively to produce red blood cells, and a deficiency of any one of them will lead to anemia. But be specific as to what type of anemia we're talking about. Paleness of skin, lethargy, which is tiredness, shortness of breath, dizziness, inability to exercise normally, and I'm just going to add in there glossitis. Now, dietary modifications is the same as specific dietary requirements. And as I've said to you on a few occasions now at this point, always try and give a balanced answer, whether it's a long question or whether it's a short question. If you're asked the specific dietary requirements of any diet, what should you avoid, what you should include, try and reference both if at all possible. So we have include, avoid. So what should we do? We should include plenty of iron-rich foods in our diet. Ideally, ferrous iron, from animal foods. So red meat like beef, like lamb, also things like offal, like liver pate. Some people like pan-fried liver. Then, of course, you could have black pudding. If we're going to have non-heme iron or ferric sources of iron, remember that vitamin C must be included with nuts, with brown rice, with whole cereals, with dried fruit, with green leafy vegetables at the same meal, in order for the vitamin C to act as a reducing agent, removing one molecule of oxygen from the ferric iron to reduce it to ferrous iron, which is the only way that the body can absorb iron in our intestine. Include sources of vitamin C, which we said, in the event that you're having ferric iron to help the absorption. I'm just going to write here of ferric iron into the body. Then we have vitamin B complex, which we mentioned earlier, the B6, the B9 and the B12. We said they work together to make red blood cells. Avoid tannins, because we said these tannins belong to a group called polyphenols or polyphenols. So we'll just note there, polyphenols, whichever way you want to describe it. And then, of course, don't forget avoiding too much oxalic acid, where you have oxalates formed in the body which interfere with both iron and calcium absorption. And then avoid excess or too much phytic acid, which phytates can form and interfere with the absorption of iron. So just there, a quick recap. Anemia, know the symptoms of anemia, but an honours student will know the 3 different types. Don't go the road that everybody else goes, which is automatic. Oh, anemia is due to a lack of iron. Yes, it is. Plus, it could be a lack of pyridoxine B6, a lack of vitamin B9, folate, folic acid, or it could also be a lack of vitamin B12. And just a reminder there, vitamin B12 cobalamin has not been asked since 2009, which is 16 years ago, on question 1B. Right, we have osteoporosis covered in another lesson. So we're moving on there to hypertension or high blood pressure. Now, the likelihood of being asked about high blood pressure on its own would be very, very slim. Like, we could potentially be asked about anemia, osteoporosis, heart disease, diabetes, celiac disease, obesity, etc. on their own. But we need to be aware of high blood pressure, hypertension, and its causes, because it overlaps with obesity. If people are extremely overweight and for their, way beyond the weight that they should be for their average weight range, well, then that potentially can cause their blood pressure to rise. And if blood pressure is very high, this can put a severe pressure on our heart. It can contribute to heart disease and so on. So it's interconnected, shall we say, with heart disease and with obesity. So that's why we want to mention it briefly. So hypertension is high blood pressure. So ideally speaking, to lower blood pressure, as well as having a healthier lifestyle where you're not drinking excessive alcohol, where you don't smoke, where you are looking at your diet very carefully. The best thing to do is to look for what we call a low salt diet. So table salt is sodium chloride. A reminder that sodium happens to be an exception to the rule. Remember, we said it's the only micronutrient that is measured in grams, and whereby the RDA or the RDI, whichever you like to refer to, is 1.6 grams for an adult. We note that we do go beyond this recommended daily intake or amount. So on average, we should be taking in, well, not that we should be, but a safe range of sodium in our diet would be between 6 grams and 9 grams a day. But it's frightening to think that the average Irish person is taking 12 to 15 grams of sodium a day. And much of that sodium is what we call hidden sodium. So we're all aware, of course, that you sprinkle physical salt on your food. And talking about that, Irish people are just unbelievable for this. I don't think I've ever seen any other culture do it, whereby an Irish person sits down, they might have been given a bowl of soup or whatever it happens to be. Before they even taste the food, they're out with the shaker, the salt shaker, and so on. So that's one very simple thing we can do to cut back on sodium in our diet. Taste the food first and try and avoid it. Then we've got processed food. And food that is very processed or highly processed, it tends to lack flavour. Because of the processing method. So as a consequence, the food manufacturers put in salt to try and replace the lovely flavour that has been taken out of the food during the processing. So we can go and take more than 1.6 grams a day as adults. We can take anywhere between 6 to 9 grams is considered a safe amount of sodium a day. However, 12 to 15 grams is what the average Irish person is eating of sodium a day. And this can lead to high blood pressure, which we've mentioned, fluid retention, where you've got this kind of puffiness around the ankles particularly, and the body's just holding on to more water than it should do. Dehydration, obviously thirsty, which can affect all sorts of things like cell activity in the body. Kidney stones, very, very painful. Gastric ulcers. So how can we cut back on sodium? Replace sodium chloride with potassium chloride, which is low salt. Now, if you don't do chemistry there, just to be aware that this is normal table salt, sodium chloride, and you replace it with potassium chloride. And if you're not familiar with the symbols from the periodic table, like NaCl or KCl, write the words replace sodium chloride with potassium chloride. Use alternative seasonings. So have your peri-peri chicken with your chili, have your lovely Italian herb sprinkled over your roast chicken. Maybe you can use extra garlic, some pepper, and so on. Then avoid convenient foods. Avoid, like I said earlier, eating these highly processed foods because the the flavour has been taken out of them. Low salt versions, you've seen them. Low salt popcorn. Better still, go for unsalted products like the unsalted butter, the unsalted popcorn, and avoid too many snack foods out there because many of them have a lot of salt. And like I said, there hidden sodium in these convenience foods. Right, the last one we're going to look at for today is the dental caries. Now, another word for dental caries would be dental decay. And I would have said to students doing Leaving Cert 2024, learn this well, because we were concerned that maybe carbohydrates would come up, and overconsumption of carbohydrates could result in weight gain, obesity, type 2 diabetes, but also too much sugar could result in dental decay. So as I said to you at the beginning of this chapter, I think personally vegetarianism, high fibre diets, lactose intolerance, all of what we have in here, that is a really important part of the core of home economics. Whereas a lot of students focus in on the nutrients and the food groups, you must remember that question 2b on a few occasions has not been on a food commodity, it has been on diets. Now, first of all, can I say to you, there's absolutely no need to learn the diagram of the tooth. I just put it in here so that we're aware on the surface of the tooth we have this enamel here, and enamel is considered to be the hardest substance in the body. Enamel is even harder than bone. So how do dental caries come about, or dental decay? Well, I remember as a child at the dentist we would have gone to as we went through our school years was always talking about the sugar clock. And what he meant by the sugar clock was every time you eat a sweet or something sugary, for 30 minutes, thus the term clock, for 30 minutes after eating that sweet, the pH in your mouth drops. Now, he wasn't as technical at that, but we knew that something happened in your mouth that would encourage bacteria to grow. So if I eat something sugary for 30 minutes after I've eaten that sugary food, the pH in my mouth drops to 5, which, as you know, if it's below 7, it's acidic. So the pH in my mouth becomes quite acidic. And this acidic environment is absolutely perfect for bacteria which are naturally present on the surface of our teeth. For them, they consider party time because there's sugar in your mouth. The pH is 5, which is a perfect environment. So what the bacteria do is, for that half an hour, they metabolize the sugars on the surface of your tooth, and they produce a substance called plaque acid. And it's this plaque acid that over time can corrode this hard substance enamel. So you've got a perforation or a cavity in your tooth. So it's much better. Obviously, everyone deserves a treat now and again, but it's much better if you decide, I'm going to have a couple of squares of chocolate, or I'm going to eat those couple of sweets. Eat them, be done with it. pH in the mouth drops. This is why we're told wash your teeth after you've eaten your meal, because of course the toothpaste is going to neutralise the acidic pH and stop the bacteria from working. But if you've got small children particularly who've been given a bag of jellies or a bag of sweets, and they eat one, and then a half hour later they eat another, and then they eat another. So they're munging away at the, that's a West Limerick saying, munging away. So they're eating the sweets as they go along. So if you're constantly, eating sweets over a couple of hours, the pH in your mouth has been acidic for that number of hours, loads and loads of plaque acid, and that can cause the corrosion of the tooth. So dental caries, tooth decay. So just put that to it properly. So we'll do, right, so dental caries, another word for tooth decay. A nice description of that is it's the progressive destruction of teeth by this substance we said, plaque acid. How plaque acid is generated is bacteria in our mouth metabolize dietary sugars on the surface of the tooth. They work best after food is eaten when the pH drops to 5, which is acidic, for about a half an hour after eating food. And then this plaque acid causes demineralization of the enamel on the tooth. So all of that to be learned. Initially what will happen is, as the enamel is worn, you see the way you'll end up going in through the dentine and the pulp, and then of course it's going to meet up with nerves, and when that happens then you have pain. So pain when eating, as it becomes more persistent, a sign that decay is approaching the pulp of the tooth. If the pulp dies, an infection from the bacteria, so if the perforation is in the enamel, the bacteria now have a burrow or a way into the centre of the tooth, and that's what causes the infection or the abscess. So you can have swelling in the face or abscess, and the underlying bone supporting the tooth is eventually destroyed, and teeth become loose and painful if this is allowed to continue. So ways to reduce dental decay, 3. 1, avoid the sugar. Like 1 330ml, a standard can of fizzy carbonated drink, like a can of cola, a can of 7-Up, a can of Fanta. We're looking at 10 teaspoons of sugar. Now the average adult, we're told we shouldn't be consuming more than 6 teaspoons of sugar per day. And yet in one can of fizzy cola, you're looking at 10 teaspoons. Then you have those energy drinks. Now, as well as the taurine, taurine present in one standard can of, say, Monster drink, 17 teaspoons of sugar a day. So avoid the sugary carbonated drinks, avoid the energy drinks like the Monster, reduce your overall intake of sugar, eat snacks like fruit, nuts and high fibre bars, but make sure that the fruit in question happens to be low fructose fruit. Remember we said we should have 5 to 7 servings of fruit or veg a day. Of that 7, 2, maybe 3, but ideally it should be a 2-5 breakdown. 2 portions of fruit, unless of course it's low fructose fruit. So there's more vegetables than fruit being taken daily because of the fructose present. So remember blueberries and raspberries, and you'd even know that these fruits are not high in sugar because of the tart flavour. Secondly, remove bacteria, and the best way to do that of course is washing your teeth with a toothpaste, or also flossing in between the teeth to get rid of the food, because if there's no food in between your teeth, the bacteria have no interest in being there. And number 3, strengthen the enamel, ideally with fluoride, which will strengthen the teeth. particularly strengthen the enamel. So that's our three different diets for today.